Okay, if I need a mover and a seconder to call the meeting to order, moved by Councillor Belinda Kistemaker, second by Councillor Peter Kistemaker, be it resolved that we do call this regular meeting of council to order on Wednesday, June 28th, 2023 at 6 p.m. If there's no objection, we'll continue. Councillor Belinda Kistemaker, please.
The Council of the Corporation of the Township of Hornepayne would like to begin by respectfully acknowledging that the land on which we gather here today is the Treaty Number 9, 1905-1906 territory, the traditional lands of Indigenous peoples. As we work towards reconciliation, may we all live with respect on this land and live in peace and friendship with all its diverse peoples.
Thank you, Councillor. Item number 3 is the review or note to any changes to the agenda. There is none, so we're moving to the approval. If I can get a mover and a seconder, please. Moved by Councillor Drago-Stefanik, second by Councillor Ted Sheneman. Be it resolved that council does hereby approve the agenda as presented. And if there's no objection, we'll continue. Item number 5, declaration of pecuniary interest and declaration of conflict of interest. I don't have any paperwork as of yet. Council, you can do that anytime throughout the meeting if such a situation arises. Oh. And yeah, go ahead.
Mayor, I believe that there is one that you might have for the closed.
Oh, yes, I do. Thank you. I said that in my agenda meeting. I do have a, is it 7.3?
It is, yes.
I'm forgetting my own here. Okay, so I am declaring a conflict for 12.4 and open, and it's part of the closed agenda. And if Councillor Belinda Kistemaker will chair during that time. Okay, thank you for the reminder. Okay, so moving on is 6 is deputations, presentations, tenders, and open discussions. And we are welcome to, or happy to welcome Dr. Catton here today in person. I have to state a huge thank you because the health and welfare of our community depended quite greatly on all of the communication we had through the pandemic. And we're really happy for you to be here today and tell us about the health unit. Okay, go ahead, the floor is yours.
Thank you very much, and thank you everyone for having me today, and really pleased to be here. Nice to finally be back in person somewhere. I've only made it to Hornepayne once before, so it was lovely drive in yet again, and nice weather to come. And so definitely I think, you know, part of the thanks right back is that the public health response and the community response to COVID really also depended on municipal connections and other partners. And municipal connections were really one of the key connections that we had for such a public health emergency. And I think it was a good example of how public health does so much of our work outside of the health sector. So we work, you know, obviously we're part of the health sector, but a lot of our work is done with municipalities, education systems, and other partners. And we really needed everyone on board. And it was always a pleasure to work with you, Flora, and everyone else in this community. And I know our team felt very well supported as well. And so huge gratitude to that, because it is hard for small teams of the health unit, you know, during such a time. So definitely appreciate that. So I do have some slides, but I'll just keep talking anyway, so don't worry. So basically I was just going to talk a little bit about public health in general and the Porcupine Health Unit. We know that the pandemic definitely put us in the forefront across the province, but before that, many people really didn't know what public health was, what types of things we do, because often we're behind the scenes. And if people haven't heard about us, that means that things are going well. And then when you have massive emergencies like Walkerton, which I know there was some discussions here around that yesterday, when you have pandemics, when you have other emergencies such as evacuations to host, heat emergencies, then you hear from public health. But a lot of the work we do is behind the scenes, trying to protect the health of the population, promote health and well-being of everyone within our population and region, preventing disease and injury, preparing for emergencies such as the pandemic, and the health of the entire population rather than individuals. So I think oftentimes people think of public health in terms of the vaccine clinics, which obviously were a huge opportunity during COVID and really incredibly important way to get us out of the pandemic and to save lives and help with the healthcare system capacity. But we do a lot more that's not patient-centric, and it's really looking at the whole population. And so let's go ahead to 6. There, that's better. So when you think of the population itself, we look at the population, the policies, the social determinants of health, such as housing, where people live, work, and play, healthy behavior. So what types of supports do people and communities need to make the healthiest choices possible? Healthy communities, so creating safe and supportive environments. And we know the built environment is hugely important to the health of our population, especially in the north. Incredibly important opportunities. When you look at things like having not only formal recreation opportunities, but having good lighting, good streets and cleared streets in the winter, I think is a big unique one for us in the north, or sidewalks so that kids can walk to school safely, kids can be out and be active, families can be active in the community. And then population health assessment, so really learning what the health of our population is and how can we use that to guide what types of things we might be able to do to improve that status. So the Porcupine Health Unit, we're the largest geographic health unit in the province, over 274,000 square kilometers. That was really interesting during COVID for sure. We have 10 offices in 9 communities. We serve a population just over 84,000. We share lands with 11 distinct First Nation communities and many urban Indigenous peoples, which is very unique and quite a wonderful opportunity, I think, for us, not only as a health unit, but I think as a population in a region. And obviously as well, one of the highest Francophone speaking proportions in the province at over 40%. We have fewer community partners, which does lead to public health filling more gaps often enough than we might see in other areas and more urban and larger health units. We have province-wide standards that are minimum requirements for fundamental public health programs and services. They're published under the Ministry of Health, long-term health, it's just Ministry of Health now, under Section 7 of the HPPA, which is the Health Protection and Promotion Act. And so that includes the legislative principles that we all are guided and we have to follow. So the HPPA, the Health Protection and Promotion Act, and the Ontario Public Health Standards. And the Ontario Public Health Standards includes 13 standards. There's 4 foundational, so things like our population health assessment, making sure we're looking at health equity, and then 9 program standards. And under those, there's 20 guidelines and 23 protocols. And I'm just you can read through these another time, but it's just to give an idea of the breadth and depth of public health and how much work we're really called on to do in our communities. And the next one, slide 10, is particularly busy, and I don't ever read this one out, but the protocols essentially are the guidance documents that we have to follow. There are things like follow-up for tuberculosis, which we've seen an increase in across the region in the last couple of years, whereas the guidelines are things that we do. We're still required to address them, but we'll do them based on local priorities. People and different health units will address them in different ways based on their priorities and capacities and what the local needs really are. So the next one is just showing how large we are, which I know you're well aware of, larger than the United Kingdom. I think that was really abundantly clear during COVID when we would be on provincial calls looking at the vaccine rollout and what types of things were happening in southern and central Ontario, and the shock on ministers' faces when we were talking about needing to transport vaccine, across 5 hours to have it here, and why we would need more vaccine than other areas would need, because we actually had to have vaccine in each of our offices and we couldn't wait until people ran out to send new vaccine. So there were lots of really unique things that we were able to do and had to do because of our geography and because of the unique needs of our region. I've already mentioned the number of offices, and this is sort of our staff. Pre-pandemic, we were just sitting around 120, usually permanent full-time positions. And as you can see, we've had many more part-time, full-time, temporary part-time positions, and that's due to COVID funding still that we're able to receive. It's not permanent funding, but we do still have added requirements for the COVID program itself, and some other unique programs that were added, recognizing the need that came about from COVID itself in infection prevention and control. So when we look at funding and accountability, this is always a huge one and really popular at municipal tables, I know, and at AMO, which is usually when we hear big exciting announcements every year. So local public health is funded in a cost-shared formula with municipal and provincial portions. Some programs are cost-shared and some are 100% provincial. So one example is we get 100% provincial funding for the Ontario Senior Essential Care Program. So that is something that the province funds 100%. We get all the money for that program. Other programs are cost shared. In January 2020, there was a provincial policy change that impacted the entire province. And prior to that, it was 70% provincial and 30% municipal, with many of the 100% funded programs were moved over to cost shared, and the funding formula switched to 75 provincial, from 75 provincial, 25 municipal. So in that year when this was announced, obviously there was a big concern, especially for some health units that were further away from that 30-70 split. There are some health units with their municipal portions are already above 30%, and they weren't impacted quite as much. The mitigation funding was announced in that year by the province to offset the municipal costs associated with this policy change. We have received that mitigation funding every year since 2020. It has not changed, so it is still essentially underfunding the mitigation, funding. We lose money every year on this new funding formula as a health unit. So it hasn't changed despite increasing costs and rents, benefit, all of those things. It's been promised for 2023. However, we've been told to plan to not have this in 2024. So we haven't officially heard, but we're all sort of working and planning that will not happen. That's a pretty significant impact. I think the other important thing to note is that, I'll skip to the next slide. We haven't had an increase in base, so permanent base funding. Public health has not had an increase since 2014. And 2022, we had a 1% increase. So from 2014 to 2022, there was no increase in base permanent funding for public health units. In 2022, we had a 1% increase. So for the Porcupine health unit, that was $72,000. So that didn't even offset the losses that we had from the mitigation funding. So despite hearing the incredible investments, which we know we are super grateful for and was definitely needed for COVID-19, as well as things like infection prevention control and the Ontario Seniors Dental Program, our base funding for all those other buckets of programs that I showed has not actually increased in many, many years. And the COVID funding is ending. It was one time. It wasn't, increased base funding for public health units that was going to be continued. And so we expect that to discontinue at the end of this year as well. Although our COVID response needs, and recognizing that people are not seeing the numbers that we have before, but we're still responsible for the COVID vaccine. We're still responsible to work with COVID like we do other infectious diseases in long-term care homes, hospitals, and things like that. So it's going to be an interesting year to come for public health. When you look at return on investment, this is always an interesting conversation because a lot of the things that we do are long-term. A lot of the things that we do are either we're preventing something that's never happened, so it's really difficult to demonstrate that our food inspection services of high-risk food premises have prevented significant foodborne illness, which would cost the economy with people not being able to go to work, which would cost, workplaces locally if people weren't able to go to work, or if we had to shut down a place because there was some major foodborne illness, recalls, all of those types of things. So a lot of the savings in communities and across the province is not seen because we're preventing things before they happen. The other thing is that it's often hidden, quiet. It's a very small proportion of health sector spending. So when you look at the health care, I think we're about 2% or not even 2% of all the healthcare spending. So very, very small bucket for the amount of work that's being done and the impact that we can and do have on acute care services. When public health, when we're doing all the things that we're able to do, and even when we look at COVID, there was a huge impact on decreasing the need and usage of healthcare services. And we see that also in follow-up and prevention of other infectious diseases and preventing other illnesses across the district. We have a broader partner engagement. So outside of the healthcare sectors, we work really closely not only with municipalities, but also with education as another example. So myself, my team, and the MOH in Timiskaming Health Unit met with the 9 directors of education. So we share 4 school boards with Timiskaming Health Unit. Algoma, I know, is here, the solo. We actually just put all the directors of education together, and we met weekly for just over 2 years to support and work with education on the response to COVID. And the big thing is looking at healthy, active communities, which I think we can all realize is a huge investment and a huge return on investment. If we have healthy, active, connected communities who are involved, who are productive, who are working, who can contribute, who are happy, what a difference that does make. So local public health is critical, and we definitely saw this during COVID. There's a rapid response to local trends. We were able to really look at what we needed to do in each community and region, which was quite different. And so some of the things we did is we realized early on, I think I'm gonna get to it soon, but that we couldn't really follow the age groups that were given by the province for the vaccines. It got to the point where, Hornepayne would be so caught up in the clinics because the turnout was fantastic that to hold off on vaccinating, the 60 to 70-year-old age group because the province wasn't opening up for a week later didn't make any sense anymore. And so that was really strictly held elsewhere in the province. I have to tell you, and we sort of got to the point where we said, we can't do this. We're sitting on vaccine. We have people ready to vaccinate. We have people who are ready for vaccination. We don't have the healthcare capacity to deal with this and sit around and wait. We're going to keep moving forward. And so the province was really good. They were very understanding of that, and we just sort of kept moving. And so we just moved through the age groups as much as we needed to make sense, and sometimes way ahead of schedule because we needed to, because our trends were so much worse in other areas. And so that was a real benefit. We also had our own booking system, which was a huge benefit because a lot of other health units had to use the provincial booking system. And so you had to follow the way it was gated. We had our own, and so we were able to add clinics. We were able to add spots. If something filled up and we had enough staff, we'd add an extra 10 spots for a day, or we'd bump in a few extra sessions. So that was a huge benefit. So that's just responding to the local needs, tailoring to priority groups, responding across a large rural area, innovative ways to connect, and really just knowing the communities. I know the team here, they do amazing work, and that's the same across all of the communities of the PHU. The staff is incredibly connected with the local community. They really love the community, know what's going on. They're able to advocate and say, this is what we kind of need here. This is what's going to work here. This would really be great. And so we're able to do that, which is wonderful. And I know they really appreciated the support from the municipality, from the health team, from education, and everyone here. I just highlighted a couple of quick things. When you look at substance use programs, and I have no idea of time, so I'm really...
Oh, you're all right.
I'm okay?
Yeah.
All right. Just give me the hug. We know that opioids, unfortunately, continues to be an emergency across the region. It really is across the province and across Canada. In 2020, we had the highest rate of opioid-related overdose deaths in the province compared to every other health unit. We've unfortunately remained in the top 5, and the top 5 have really been all across the north. And I think the important question, and some of the things that we've been looking at with the other northern health units, is what are the other types of things that are going on in the north that put us at greater risk? What are the other factors that impact this, right? And so we know there's many things. We have increased substance use to begin with. Our alcohol use rate is higher in the Porcupine Health Unit region compared to the province. Our tobacco use rate is higher compared to the rest of the province by about 10%. And so when you look at those rates, the healthcare costs of those are significantly higher. The tobacco cost alone is still the highest cost to our healthcare system in the province. And so when you look at all of those things, it's not, unfortunately, surprising that we would see other substances follow suit. We also know that it's all strongly linked to social determinants of health. So when you look at housing, when you look at historical trauma, when you look at colonization, when you look at availability of foods, availability of other support systems, mental health support access, all of those things make a huge difference. And that's unfortunately one of the areas where we really need to continue focusing on in the north and in the PHU. Health equity in the north is very different. Our population faces very unique and very extreme challenges in having opportunities for health and well-being, and it requires a different lens. And there's not an easy fix to any of it. And so definitely important that we keep working in that. So we're really looking at primary prevention, obviously trying to really prevent it before it happens. So how do we have healthy, connected communities for young families, young parents, when they're having kids, when they're considering having kids, that they feel connected, that they have those supports. We tend to have a lot of high risk births across our region. So a lot of parents that will, test and have sort of some high risks for concerns and really needing support. So what are those types of things we can do, right? How can we make sure there's access to food, access to appropriate housing? So some of those basic things that so many of us are lucky to never worry about are often first and foremost, and you can't start worrying about all these things if you don't have some of the basic necessities. And so really focusing on that is so incredibly important. I already spoke a little bit or quite a bit about the COVID-19 rapid response to local trends. I think that's something we did do extremely well. And I know some of them weren't necessarily popular decisions, but they were incredibly important decisions. And so I think a few of the other unique things we did was early on, we didn't have testing capacity right across. So we had a unique partnership with Cochrane District EMS, where I actually had a medical directive under my name, and we worked with them to do the training for all of the testing to be done in some of the smaller centers, and we're able to follow up on testing early on while other partners were still trying to set everything up, because we started to get cases really early, right? I mean, March 20th, we had our first case, and we were hit really hard in that first wave of the pandemic, earlier than a lot of the other Northern Health units too. So, and then we know because our population is at greater risk overall, unfortunately, we had a pretty tragic outcome. So we had over 370,000 kilometers traveled for clinics, vaccine clinics alone. And these numbers were done by the end of May 2022. So our first vaccine delivered here was January 26, 2021. And these numbers are by the end of May 2022. So significant travel. We had over 130 mobile clinics. We started doing them long before the province started doing them, where you heard of the Go Bus and all those fancy things down south. We were doing them right away because we had to. We were actually, our first pop-up was at the Metro parking lot in Timmins. Oh, no, Food Basics maybe. Metro or Food Basics was the first one. And then we did the Highway 11 corridor where they did a pop-up with EMS. And again, Cochrane District EMS was a great partner. And many healthcare providers across the region really stepped up, in municipalities and other partners to support the clinics and, you know, house facilities and help the staff and support the staff through it. So it was fantastic. I think the one thing we saw in the north for sure, and especially across the PHU, is we had innovative opportunities and innovative answers to things that were challenging. So our unique local circumstances and needs, we came up with different opportunities in different ways, not even just within the PHU, but even sometimes for different communities across the PHU as well. We use local data and knowledge and partnerships to really identify and address health inequities. So the province would give us data based on postal codes for vaccine coverage to sort of tell you where you needed to go. Well, our postal code covered like South Porcupine to Moosonee to halfway across to Hornepayne, and we're like, the postal code doesn't help us whatsoever. So we needed to connect with our partners, our school partners, municipalities, friendship centers, our local staff to really know where do we need to go. And so, you know, we worked with Cochrane District Social Services Board to go into low-income housing. We worked with friendship centers to decide where could we have clinics that might be more welcoming, safe spaces, that might be more opportunistic, so that people don't have to worry about things like transport and all of those things. And so we really worked hard for that. And so it just really showed that the partners across the district made the biggest difference. So population health status, I wish I could say it was great news. Unfortunately, it isn't. I think we are incredibly innovative, supportive, and strong in the north across the PHU, but unfortunately our health status is not so good. We have poorer health status generally in most indicators compared to the rest of the province. We have higher rates of cardiac events, greater rates of preventable death. We have elevated rates of diabetes. It's often diagnosed at younger ages. Usually this is related to diet, tobacco use, activity levels, mental well-being. All of these things are impacted by the physical built environment, which is another good plug for municipalities and opportunities to support that, and the social determinants of health. We have higher rates of sexually transmitted infections, bloodborne disease, greater rates of accidental injury. Mental health concerns in children and youth is significantly higher in the PHU versus Ontario, and then increased substance use. And I think the thing is unfortunately, we know the mental health concerns have increased really across the spectrum since COVID, and that's been pretty clearly articulated from many sources. And so this is just, unfortunately, more data of some of the concerns. So one of the big ones I'll just flag is the low food security rates. That's a huge challenge across our region. And it just gets worse, I know, as you move out of Timmins and out of central areas, but the food security is really tragic and unfortunate, and something that I think we definitely want to continue looking at. And then we all know, and I think Hornepayne knows really well, the unique challenges for a population, but for the health unit itself, just due to the distance, having many small communities, there's fewer community partners at the table, not only as a region, but in each community. And so we often end up filling more gaps. So for instance, we have some communities that have no primary care at all right now. We know that's a challenge across the province, but in the north it is significant. And so we tend to end up doing a lot more of the cervical cancer screening, or all of it, if it, because it wouldn't be done, sexual health clinics, vaccines. It really leads to a lot more work in those realms for my team, which means that we're not able to sometimes concentrate on the health equity issues, the social determinants of health, the things that we know we also need and want to do to decrease the smoking rates, to increase activity, to try and decrease those other indicators and get people living longer and healthier in the region. Strong public health and municipal connections are key, and we saw this during COVID, and I think it was done extremely well. Sharing important information, via local channels. We know that when we had municipalities and mayors that spoke up and delivered messages directly to their community, that made the biggest impact. I could say things all I wanted from way down the Highway 11 corridor, but having those local champions and leadership in the municipality was absolutely key. And we continue to see that now. So we have the heat emergencies and the air quality emergencies that we're now looking at responding to. And we've been connecting with municipal partners and hospitals across the region to, look at our response to that and the provision of masks for individuals who might be at high risk, to see if they find it helps, because it may help a little bit with the air quality from smoke. So some of the other things are just some municipal, and these are just examples in terms of bylaws. When you look at municipal role in health and well-being and public health, some of the things that came about over the last few years was ensuring that cannabis and e-cigarettes are included in smoking bylaws. Oftentimes people sort of think they're assumed to be there, but really being explicit about it. Limiting use on all municipal properties. Multi-unit dwellings is another popular one. That's obviously a concern because there is often shared air exchange. Cannabis stores, production facilities, so really looking at location within communities. There is some limitation with respect to, next to schools and things like that, but really having a good look at that within a community realm. And we know that the vaping use in youth across the north is pretty high. And when speaking with our education counterparts, even over the pandemic, that still remains one of the #1 concerns, is the amount of vaping and e-cigarette use seen in kids. And there is still, unfortunately, flavoring allowed, although it was supposed to be limited. And so there's been a lot of advocacy from public health to stop that, because obviously that is essentially targeting youth. And unfortunately, still often a lot of nicotine in these products, which is ending up, they're starting to demonstrate that unfortunately it's leading to starting actually smoking. And so that's exactly what we don't want and need. And so really looking at opportunities for that. And then I spoke about the built environment already, and opportunities that we have there to work together. And healthy eating is another obviously huge one that we're really trying to work on across the region as well and across the north. And then when we look at the roles, it's really the strong local connections, engaged partners, looking at opportunities, where we could support bylaw revision, policy development, awareness and promotion if there's a particular need within a community. And then public health going forward. I think, COVID demonstrated, I think, the strength of local public health, the need for local public health. It doesn't work having everything come from a central organization. How we did things was very different than the rest of the province, and it needed to be. And I think that's really incredibly important. And we also recognize that there were times where it needed to be different within our communities across the PHU. When we look at challenges going forward, so public health is actually really specialized expertise and skill set, and it's really challenging, similar to other areas in the health system, for retention and recruitment right now. Public health inspection is very specialized and really challenging to hire and keep, unfortunately. And that's a group that does, all of the restaurant inspections. They do all the inspections, work with the long-term care homes on outbreaks and retirement homes. They're the ones that are working, with me in responding to environmental outbreaks, other diseases, foodborne illnesses, rabies, which we've seen a lot of bites and reports for rabies or potential investigations for rabies during COVID. And so really important to look at how we can work together to try and welcome and recruit and maintain this staff. Funding, as I mentioned, is a big concern moving forward, anticipation of potential loss of that mitigation funding, as well as, potentially or most likely losing the COVID funding and that we've been able to access in order to provide the services that are needed for that. Also, often we get one-time funding, which obviously we would never turn away. That's fantastic, but it's really hard to keep staff on long enough when you can't anticipate how long you're going to be able to keep them. And so there's some things that really should be permanent, and we keep advocating for that as well. And then, as we know, health equity and opioids, mental health and well-being, obviously addressing our chronic disease rates really important, but we're do a lot of work in emergency response in the PHU. We have a lot of unique emergencies that sort of just continue. And so, supporting evacuations, we support host communities, and we support those who have been displaced from their home for one reason or another. We've responded to one of the largest blastomycosis outbreaks that has been seen in Canada. We continue to see increasing tuberculosis rates and outbreaks. We have, unfortunately, we can still see a continuing increase in opioid related concerns. And then we just know that our health status really needs that attention. And so really looking at health equity and how are we going to support the population in a way that makes sense, that addresses the social determinants of health, so that we can continue to look at all these other things to have a healthy and well population moving forward. Thank you. Let's see, Miigwech, I think. Oh, close.
Very good. Thank you. No, thank you. Don't worry at all. It is our pleasure to host you, Dr. Catton. Okay. I really enjoyed the presentation. I know I have a couple of questions, but I'll open up the floor to council first for any questions. Go ahead, Councilor Kismaker.
And Dr. Catton, is there any leading factors why this area is, there's a couple that were double and some are 5 and 10% higher, the rates in certain things like the addiction and mental health, and is there any leading, why are we different than the rest of Ontario? And TB, why are we higher? Is that something, is it because of the anti-vaxxers, or is it, because I thought you could get vaccinated for TB?
That's for you. Yeah, go ahead. No.
Both really good questions. So one is that the PHU numbers, yes, they are upsetting and shocking to see, and sort of always a bearer of bad news on those on those items at pretty much every meeting. I think there's many things. One I would say is a lot of it's probably across the north and not unique to the PHU. Okay. So I can't say exactly what each health unit the numbers are. Some of our numbers are still, higher. In some of these numbers, some other health units might be higher, but in general, probably the north, the population tends to fare not as well in terms of our health status. And I think a lot of it is health equity and the social determinants of health. So when you're looking at housing, when you're looking at opportunities for well-being, when you're looking at the rates of historical trauma, of other trauma, access to other support services, all of those things can definitely combine. Income, all of those factors are huge. Education level, right? All of those things start to add up. So I think it's multifactorial, it's complex. It is something we're starting to question even more, sort of as a northern MOH group, even when we look at the opioid rates, and when we look at some of these things and some of these other infectious diseases that we're seeing increase, how and why are we so different than the rest of the province? And so it is important, and I think it's recognizing that it's a little bit of everything is my suspicion. The second question is for tuberculosis. So you're right, there was a time when there was some vaccination happening, but it doesn't usually, it doesn't really happen anymore. It was happening in high risk areas. We know that we see increased rates in individuals that are traveling from other countries often, or moving from other countries. Also overcrowdedness, housing is a huge part of tuberculosis and spread. It is very much a health equity and social determinant of health. disease and infection that we see with tuberculosis. And we also see higher rates in Indigenous individuals and First Nation communities. And that's still directly linked to historical trauma, which is pretty significant, especially related to tuberculosis. And again, related back to the social determinants of health in terms of housing and availability to care, availability for, meaningful, mindful, culturally aware, appropriate. Yeah. So we've seen some increases there too.
Thank you. That answers your question?
Yes.
Yes. Councillor Chenman, go ahead.
Through you, Madam Mayor. Doctor, so has the PHU separated the First Nation units and looked at that to separate from that? Like when I worked in Sandy Lake, we know that 13 or 14 people in a house. And we look at those numbers, we have to separate those to be able to draw the attention that needs to be done. If we don't take those numbers out of the equation, the whole thing it just isn't true. It just isn't true numbers. I mean, yes, Timmins, of course, because of the influx of First Nation people coming in there are certainly turning that numbers around, but we have to look at those reserves separately. Has that been done, or is there an anticipation of doing it? Sorry.
Yes, go ahead.
No, I definitely agree and hear you, and struggle with the same emotion in seeing and hearing the stories and what's happened not only historically but still currently today. That is so incredibly inappropriate and just wrong, to be honest. There's a few things. So I think the one thing is recognizing that we, or I as a health unit or myself, don't own First Nations data or history or their story, and that story belongs to each community and belongs to those individuals, and so being respectful of that. And so that's one of the big things, right? So a lot of it is that data is often not separated by that. When you look at infectious diseases, for instance, even though public health in most First Nation communities is sort of a combination, or it can be different across the province in terms of First Nation led, so that community led. They may have their own public health system and accountabilities. There's Indigenous Services Canada that provides public health, and then there's provincial public health, and sometimes it's a combination sort of relationship. That being said, even though I don't have the same type of jurisdiction, right, I respect self-determination and Indigenous-led programs and responses within community. Reportable diseases are still reported to me as the MOH for any First Nation community that we share lands with. So for things like hepatitis C, E. coli, tuberculosis, trying to think of others that aren't necessarily blastomycosis, all of those things, that data is reported to each health unit because we still have that's reportable under the provincial system. But you're right, the data collection and reporting and the reporting of those stories is something that is really challenging. And I think it's challenging to do it respectfully and feel like I'm not trying to own someone else's story. And so I think including it in everything and being able to say that historical trauma and overcrowded housing and lack of access to care, lack of access to support services and clean water and all of those things, they make a tremendous impact. And we saw it during COVID. We see it with tuberculosis. We see it with evacuations. And so you're right, there's a lot of work to be done. And I think it's supporting First Nation organization, communities and Indigenous organizations in their self-determination of how best to do that. But it definitely does have a huge impact, and it is incredibly heartbreaking. Incredibly heartbreaking.
Thank you, Dr. Catton. Thank you for the question, Councillor. Any other questions from Council? I did have a couple. When you were talking, I totally agreed with having the local health unit involved during the pandemic. I found that we were able to pivot more easily to meet the local challenges. And I do thank you for the acceleration of our vaccine, because we were seeing it where we were halting. That was part of our table discussions, and that it went ahead. And it also, I think, encouraged us to keep our volunteers and everything, right? Everyone was on a routine and it was systematic. So it was well run, and I have to give a shout out to all the community volunteers that we had in our community and the local staff here as well.
Yes.
Like making our meetings plus doing all their other work. It was tremendous in the background. It really was.
Yeah.
And hearing the other meetings that you were put on top, meeting with the educators and all of that, I definitely, we all benefited at our table from those meetings. But to hear, I'm just calculating in my mind at how many tables and meetings you're attending and, helping. So it was, I know you've said it a couple times, blastomycosis, is that it?
Yes.
Okay, so is that still an outbreak that's happening? And I just want to clarify, is that the outbreak that was happening with people and animals?
It was mostly people, because we
Okay.
tend to not test for animals unless, so oftentimes the animal testing is not done, but it's sort of, the vet suspects it and says, we're pretty sure this is blastomycosis. So I think there were a couple that were confirmed.
Right.
And then oftentimes it's sort of, this fits with blastomycosis, but oftentimes people don't do the testing because it's expensive and not easy to do. So we don't have a current open outbreak of blastomycosis, a really good question. And I think the thing I would say is that, and the one thing I didn't mention and I meant to, but I forgot to jot it down, was climate change is definitely impacting not only the whole province, obviously, as we see all the wildfires and the smoke and the heat emergencies that we have, but blastomycosis, we're starting to see black-legged ticks here. We have blue-green algae here. When I started in public health in 2016, we didn't see any of those things here. Those weren't things that we saw. Blastomycosis with northwestern Ontario. Tick and Lyme disease was down in central, southwestern, I believe. Blue-green algae was always sort of south of us. We weren't warm enough for that. And so we're seeing all of that. And so blastomycosis is something that lives in the soil. It's a naturally occurring fungus. It is not something that we can get rid of or mitigate. It is something that will grow when everything sort of aligns and matches in terms of the damp, wet soil content, the right amount of heat, all of those things. And then there's spores that get blown up into the air and people can inhale it and get sick. And so I think the big thing with blastomycosis that we learned was that making sure that people get checked when they're not well. Right. And so, obviously now that we're starting to see these things, you're having chronic cough for a while and you're coughing and you're not feeling well, to go and get checked. And I think sometimes it's hard because we know our population, high rate of smokers, high rate of COPDers, a lot of people have a cough to begin with. So it's looking for those little changes and making sure you get checked. And then we've had a few healthcare provider notices to sort of flag. We've seen blastomycosis. We're seeing blastomycosis. Keep it on your radar. Keep it on your differential. If you have someone that's coming in, they've spent time in the outdoors and these types of things, or they've come in and had a pneumonia and they're back again in a few weeks and doesn't seem right, check for blastomycosis. Think of it. And so we're doing that with both blastomycosis and tuberculosis to sort of keep it at the forefront, because they're things that we hadn't really seen before. I worked in Emerge for 10 years and I never tested for it. I never saw it, but I also don't remember having anyone that ended up admitted and being diagnosed with it afterwards. But we're starting to see it. And so I think it's making sure that people are aware of the types of activities. It's not something we can unfortunately avoid. The nice thing that we have here is wide open spaces to go and enjoy them, but to monitor yourself and get checked, and then make sure that the healthcare providers have that at mind too, and sort of know what to test and how to test, and that labs are watching for it.
Okay, so it really was fairly new, like in the sense of, like it was around, but not necessarily in our area at all. So it took a bit to identify it.
We had it, so it wasn't reportable before 2018. And so that's the interesting part of it. So we knew that it was out in northwestern, near Kenora, actually, I think of your website, Lake area, yes. yes, that was sort of where it had been seen in the province and not really in our direction. In 2018, the Ontario Public Health Standards changed that it was now reportable to local public health. So we had seen sporadic cases since 2018. We've seen a few across the PHU, but there was never any connection between them. There was never any sort of, these were two people that happened to be hanging out in this area or, four-wheeling in this particular, bush or anything like that, until we had this episode where we had unfortunately really large and quite tragic outbreak. And we know there's been another one in northwestern Ontario just this past year as well, in the last 6 months. So I think it'll be interesting as we monitor more for it and are reporting it more to see where we're seeing it and when. But it's really key to diagnose early.
And so is there anything preventative? Because it ends up being spores. So what can people do to protect themselves from it? Because we're not going to stop going in the bush.
There's not a whole lot, unfortunately, right? I think it's one of those things where we won't know until somebody ends up ill if it's actually been anywhere that you've been in the bush, right? So unlike ticks, where we say wear long pants, tuck your shorts in, make sure you wear long sleeves, wear bug repellent, come home, do a check for ticks, make sure you take them off properly. There's not that sort of same set of rules you could follow. And even things, when you think of environmental health, we worked with Public Health Ontario and the MECP for some toxic chemicals or hard metals in a park in Timmins. And part of the messaging after that was don't wear your shoes throughout the house, right? And so, I think while that's not necessarily a recommendation we've ever given for Blasto in any way, but when you think of environmental health in general and all of the things, especially we are a mining region, and all the heavy metals and hard metals, I think that's one thing as we start to learn more with climate change and environmental health. I remember working with one of the specialists who always said, I never wear my shoes in the house. and so that, I can't say that's specific to Blasto, but I think that's one thing that, with a few things that we've seen, that seems reasonable. But I think for Blasto, it's really just keeping an eye on symptoms and checking. And then, knowing that I've been in the bush, I've been doing this, that is always a possibility, and being able to advocate for that and say that when you go and see someone.
Right, and know it's a possibility.
Exactly.
Yeah.
I think that is the biggest thing. Yeah.
The final thing I just want to wrap up with is that I would strongly believe that I can get consensus from council that we would support any funding, any advocacy for funding. We saw it with the pandemic, how important it is to have local people taking care of our local needs, and that it's not being centric from someplace that has no idea with Northern Ontario. And then just with some of the data across the north, like if we all bound together through NOMA or FONOM, I think that would be a way that we could, because really by the data, we should be getting more funding to try and combat, our health should be on standard with the rest of the province. We shouldn't be suffering to live in Northern Ontario. So anyway, I just want to put that out there that we would be definitely willing, or if there's any tables that Drago sits with you at your PHU table, but at any other tables, I think that's something that we could support moving forward. Yeah.
Thank you.
Yeah.
We have put forward, there will be a letter coming very soon that will be sent to all of you requesting an air quality monitoring stations, hopefully, across the PHU, because we do not have them anywhere in our region. So the only northern ones are the Sioux, Sudbury, I think North Bay has one, and Thunder Bay. But across the whole PHU and Timiskaming health units, we have none, and we're the biggest health unit in the province. And so as you'll notice, our communication coming forward for the air quality health index, we don't have a health index to look to. And as I said on a call with the province, we look when the sky is brown and we can't really see across our, our community, and it smells like we're at a campfire, we know that it's bad.
Right.
But looking at some of those opportunities to be able to estimate what that is, but really advocate to get them across the north. So that's one.
Okay.
I know we're hoping will help us in the future, because I don't think this is going to decrease in the next few years.
Okay. Well, you can count on us for when they come. Okay. Well, thank you so much for being here this evening with us in person. It's been delightful, and I'll take my shoes off in my house now. I know, everyone did except me. I think. Yeah, go ahead.
Yeah, personally
Yes.
thank Dr. Catton as well.
Yes.
Dr. Catton and I worked for 9 years, and I sit on many boards committees, and that's one of the committees, the board is a pleasure, and I have no questions for you, so. Today's the first time 9
Thank you.
years.
Yes.
I understand slightly what you're saying.
Are you speechless? Is that what you're saying?
Yeah. But thank you for being here. I'm glad
Yeah.
to here, accept you here. It was nice. Thank you.
And I'm wondering if you'd get a picture with all of us and yourself, like all of council and, yeah, okay, and we'll give you a shout out and a thank you and to all of your staff and the staff here and everything, because it was, I sat at those tables and Drago sat in for me and our staff, and it was, we needed the help. And yeah, all of us shouldered it, and I appreciate it. So if we could do that, that would be great.
Actually, you should do that this here.
I'm shocked. Who has the best phone? I think this is a 13.
Higher than mine.
Oh, okay. Oh, okay, there we go. Come on, people.
So Eileen, you're gonna have to get in the picture.
Come on in here, Eileen.
Well,
You can stand in for Dale.
Let's do this. There we go. Where do we go? Come on over here.
Hopefully that's one, sorry.
Angle.
Getting a little closer, guys. You guys are more spaced out.
Yeah,
so gotta scoot
here,
down.
behind Belinda. Belinda, come out a little bit.
Linda, come over to that one.
Push her around.
Where is she?
Second you got.
Ready? It took a couple, I think.
It's good.
Yeah.
Thank you.
Thank you so much. I really appreciate that. Always for everything.
Okay. And safe travels to her.
Thank you. Yes, thank you. Thanks so much, everyone. Have a great night. Take care. And if there's other questions, Drago will always be happy to ask you. Reach out anytime. Thank you. Take care.
No problem. You can find your way out?
Right.
Yeah, okay. Thank you. Okay. Okay, if I can get a mover and a seconder for the acknowledgement, moved by Councillor Drago Stanek, second by Councillor Belinda Kissmaker. Be it resolved that council does hereby acknowledge receipt of the public health presentation in the, sorry,
Yes, it should be, sorry, it should be.
in the Porcupine Health Unit Region presentation from Dr. Lianne Catton, Medical Officer of Health and Chief Executive Officer, Porcupine Health Unit PHU. Sorry, I messed that up. All those in favor? And that is carried. Okay, I gotta get my stuff back up here. There we go. Okay, so we're on to item 7, action items, or correspondence, action items. So we have a Crime Stoppers donation request, and this was brought back because we had said we would do this after our budget. So if I can get a mover and a seconder, please. Moved by Councillor Belinda Kissmaker, second by Councillor Peter Kissmaker. Whereas Crime Stoppers is a charitable community program which empowers people to make their neighborhood safe through the anonymous reporting of crimes, and whereas the increased outreach of the program in 2022 led to a successful year, and whereas the Township of Hornepayne has received correspondence from Crime Stoppers of Sault Ste. Marie and Algoma District requesting a donation of $500, and whereas the donation would help boost awareness of the program in the district, which would hopefully lead to more people calling in tips and would also ensure enrollment in the Friends of Crime Stoppers membership. Therefore, be it resolved that the Council of Corporation of the Township of Hornepayne does hereby agree to donate $500 to the Crime Stoppers of Sault Ste. Marie and Algoma District to support their programs and awareness in the district. Any further discussion on the motion? There being, oh, go ahead, Councillor.
Sorry, Madam Mayor. Personally, I'm not in favor of it, not because, I guess, I see what we'll later be talking about, our local arena programs and things. And I do believe that we need to look after our own house before Crime Stoppers is a great organization. I'm just not sure if we benefit. If we had numbers to be able to substantiate and say, have we had that? And I've never seen numbers. I'd actually emailed and asked for numbers and said, before I was a counselor, and said, what is the rates? Do we get any success from this program in our area? And I didn't get a response. So I am not in favor.
Okay, thank you, Councillor.
Sure.
Okay. Councillor Dragostein, go ahead.
Yeah, I respect Councilor Snyder's comment. So I would move this to defer it and to find that information that Councilor Ted asked for. If there was a usage by the municipality or paying, I think that's a valid question.
Okay, and this council,
I
Looking
think
to
I
defer?
Totally agree, yeah.
and I just want to add to that deferral though, that the work would be done at their end and we just inquire of it. Okay. Okay, so I put that to a vote to defer. Those in favor of deferring? And that is carried. Okay, item 7.2, if I can get a mover and a seconder, please. Moved by Councillor Ted Sheneman, second by Councillor Dragostein. Whereas the federal and provincial governments need to support their most vulnerable households, the ones who are at risk of becoming homeless, and overall housing and services for low income and vulnerable or marginalized people should be a primary consideration moving forward so we help those who need it most. And whereas the Township of Hornepayne understands that every community across Ontario is impacted by a need for affordable housing and support for people at risk for homelessness, and that the municipal governments are working in collaboration with all orders of government to invest in permanent solutions to the housing and homelessness crisis in Ontario. And whereas Council passed resolution number 23-114 on March 22nd, 2023, supporting the Association of Municipalities of Ontario, AMO's call for action for the provincial government to commit to ending homelessness. And whereas the Township of Hornepayne understands that the federal national housing strategy allocation formula to provinces and territories for jointly funded housing initiatives roughly follows their share of the national population, and this approach leaves Ontario underfunded because per the 2021 census figures, the number of Ontario households and community housing network as a share of the national total is 44.1%, which is well above the provincial share of the national population at 38.5%, and that this is also by far the highest share of the national community housing network relative to every other province and territory. And whereas receiving a by population allocation from the federal government hampers Ontario's ability to reach more of those households in need that require assistance with housing. And whereas the lack of ongoing federal operating funding for national housing strategy initiatives lead to significant underfunding for subsidized housing projects and can undermine the physical and financial viability of the community housing stock. And whereas a similar situation occurs with federal homelessness funding to Ontario through Reaching Home, where the share allocated to Ontario is also below the provincial share of community housing network nationally, and whereas there is inequitable distribution of Reaching Home funding in Ontario, as only 25 to 47 service managers have designated communities receiving funding under the program, despite the prevalence of need across the entire province. And whereas the Township of Hornepayne understands the federal government takes the position that its role is to provide capital funding while provinces and territories are to provide operating expenses. But this approach does not create an equitable sharing of the burden of funding long-term operating costs, which continue for the life of the project. And whereas taken altogether, the underfunding to Ontario for housing and homelessness relative to its share of national Canadian housing network amounts to approximately $480 million over the term of the federal national housing strategy. And whereas the federal government previously provided leadership in ensuring the long-term financial and physical viability of the social housing stock under the social housing agreement for several decades through federal social housing operating agreements that provided funding for both mortgages and operating costs. And whereas without some flexibility on the part of the federal government, Ontario and its municipalities will be poorly positioned to take advantage of this funding, and this will turn into a significant missed opportunity, leading to a further deterioration of the long-term physical and financial sustainability of the community housing stock. Therefore, be it resolved, the Council of the Corporation, the Township of Hornepayne also supports the provincial ask for federal operating funding for national housing strategy initiatives. Be it further resolved, council would appreciate the federal effort to repurpose this funding quickly from the main National Housing Co-Investment Fund program line. Service managers across the province have indicated their challenges with meeting the terms of the federal proposal, particularly as they relate to cost matching and meeting the requirements for greenhouse gas emissions, energy efficiency, and accessibility. Be it further resolved that the Township of Hornepayne would like need-driven indicators incorporated into the funding allocation formulas for all federal programs. Be it further resolved that the Federation of Northern Ontario Municipalities appreciates the federal government's commitment to end chronic homelessness and wishes this to be inclusive across all areas of our province by expanding reaching home funding to all service managers. Be it further resolved that FONOM also support the provincial position in related to the provinces and territories repair fund under the National Housing Co-Investment Fund. Be it further resolved, FONOM supports the province of Ontario position on the application-based $4 billion federal housing accelerator fund and wishes to emphasize the importance of providing municipalities with maximum support in preparing applications to have understanding that some rural and northern municipalities may face capacity challenges in applying to this program on the anticipated tight timelines. Be it further resolved that the Township of Hornepayne wishes to request that Canadian Mortgage and Housing Corporation consider actions taken by municipalities under the province's housing supply action plans into account when assessing municipal applications, recognizing that these initiatives have the potential to significantly increase the supply of housing in our communities. Be it further resolved, the Township of Hornepayne believes the lack of ongoing federal operating funding for national housing strategy initiatives leads to significant underfunding for subsidized housing projects and can undermine the physical and financial viability of community housing stock. Be it further resolved, the Township of Hornepayne believes the federal government should heed the precedent of the social housing agreement and recommit itself to funding operating costs that often stretch out over decades for the lifetime of the housing project. As an example, the Rapid Housing Initiative's 20-year affordability requirement and lack of federal operating dollars will very likely result in housing providers asking service managers and the provincial government to fund operating expenses to ensure the long-term affordability of units, given housing providers limited revenue raising capacity. Be it further resolved that lack of the ongoing federal operating funding for the National Housing Strategy initiatives leads to significant underfunding for subsidized housing projects and can undermine the physical and financial viability of the community housing stock. Be it further resolved that the Township of Hornepayne urges the federal government to provide additional funding for Ontario so that we can deal with our shortages of safe and affordable housing, and at the same time build safer and healthier communities for all our residents. Be it finally resolved that a copy of this resolution be forwarded to the Honourable Justin Trudeau, Prime Minister of Canada, the Honourable Doug Ford, Premier of Ontario, the Honourable Amin Hussein, Minister of Housing and Diversity and Inclusion of Canada, the Honourable Steve Clark, Minister of Municipal Affairs and Housing, Carol Hughes, MP, Algoma Manitoulin Kapuskasing, Michael Mantha, MPP, Algoma Manitoulin, leaders of the federal and provincial opposition parties, and the Association of Municipalities of Ontario, AMO, with a copy to the Federation of Northern Ontario Municipalities, FONOM. I think that was the longest motion I've ever read.
You said over that, didn't I?
Yeah, thank you.
Good to hear you.
I'm just glad, okay. Discussion on the motion. I do want to say that I think it is important for this. I was in meetings today. We have people in our own community that are struggling, not only to meet payments and demands, but this is a real crisis, and we're going to see it within our own community. And we do need to diversify housing stock. We don't have enough housing right now, and we're seeing it firsthand at the Hornepayne Housing Corporation. So with that said, I put that to a vote. Those in favor, and that is carried. Okay, if I can get a mover and a seconder for 7.3, moved by Councillor Peter Kistemaker, second by Councillor Ted Sheneman. Whereas Council received correspondence from the Women of Ontario Say No in regard to ensuring that locally elected officials are held accountable for violence and harassment in municipal workplaces. And whereas all Ontarians deserve and expect expect a safe and respectful workplace. And whereas municipal governments as the democratic institution most directly engaged with Ontarians need respectful discourse. And whereas several incidents in recent years of disrespectful behavior and workplace harassment have occurred amongst members of municipal councils throughout the province. And whereas these incidents seriously and negatively affect the people involved and lower public perceptions of local governments. And whereas municipal codes of conduct are helpful tools to set expectations of council member behavior, and whereas municipal governments do not have the necessary tools to adequately enforce compliance with municipal codes of conduct, and therefore be it resolved that the council, the corporation, the Township of Hornepayne does hereby support the Women of Ontario Say No, and the Association of Municipalities of Ontario, AMO's request for the Government of Ontario to introduce legislation to strengthen municipal codes of conduct and compliance within them in consultation with municipal governments, including AMO's recommendations for updating municipal code of conduct to account for workplace safety and harassment, creating a flexible administrative penalty regime adapted to the local economic and financial circumstances of municipalities across Ontario, increased training of municipal integrity commissioners to enhance consistency of investigations and recommendations across the province, allowing municipalities to apply to a member of the judiciary to remove a sitting member to recommend it, if recommended through a report of the municipal integrity commissioner, prohibit a member so removed from sitting for election in the term of removal and the subsequent term of office. Be it further resolved that council does hereby request that this legislation be prioritized for the fall of 2023. Be it finally resolved that this resolution be forwarded to the Honorable Doug Ford, Premier of Ontario, the Honorable Steve Clark, Minister of Municipal Affairs and Housing, the Honorable Charmaine Williams, Associated Minister of Women's Social and Economic Opportunity, Carol Hughes, MP Algoma Manitoulin Kapuskasing, Michael Mantha, MP Algoma Manitoulin, the Association of Municipalities of Ontario, AMO, with a copy to the Women of Ontario Say No. Any discussion on the motion? I just have the one that's similar to another meeting that I had, is that this is an Ontario motion and we're including our federal MP. And I would suggest we remove the federal MP from there. Sorry, or did they want it included with the motion?
If I can get the deputy.
Yeah, go ahead.
They did have it included in their
Okay.
draft motion, but once again, like if we want, we can, if like council wants, we can remove it. But it was just included in the original like
Yeah,
requested one, so that's why I included it.
yeah, I just think in delegation of authority and respect, we would take it out of there. Because it's not going to the federal, it's an Ontario issue. If council's in agreement with that? Yeah, okay, so we'll remove Carol Hughes, MP Algoma Manitoulin Kapuskasing. And I put that motion to a vote, those in favor, and that is carried and opposed. Okay, 7.4, Arena Summer Program Costs. And Irene, would you like to speak to this?
Yes, so I can advise council that there is a letter attached, a report from the treasurer, the comprehensive user fees, and the summer program advertising. Those are the links attached on the agenda, and the letter to Councillor Stefanik was from a resident, just inquiring about the summer program costs. And the treasurer's report speaks to the Arena Summer Program costs and whether it's for council's consideration, and her recommendation is if council would like to revise the recreation user fees, that they take the information in her report into account.
Okay, I open up the floor for discussion. Councilor Peterson, go ahead.
Anytime I see one of our townspeople wanting to bring a family up and can't afford it, we do have to take a look at the prices, because we want everybody to utilize the equipment that we have, and we have to have it affordable so that not only encourages them to keep coming up, but more people keep coming up. And in that letter, I do agree that the kids have nothing in this town. And we don't have a baseball field right now, so I think we should give some serious attention and make some adjustments as needed.
Okay, thank you for that, Councilor. Counselor Belinda?
I just want to say that has been brought up to me as well, so. yeah.
Okay. Counselor Stefanik, go ahead.
Yeah, just a preamble. The letter that was addressed to me was unsolicited, and I encourage people to write a letter to the entire council, but if I get it, we'll go to council directly. So I want to understand everybody that. Porcupine Healthiness, how Dr. Catton's sitting here, they encourage, one of their philosophies is to encourage recreation facility use, as she brought up. I missed this. I don't know how, because when she said in her letter, the author, 2 visits, $57.50, when for weight training for adult per month is $60. It doesn't make sense. So 2 visits, 1 hour. For weight training, if you have a fitness regime, you could be there 1 hour, you could be there 2 hours, it could be 3 hours. $60 a month, and this person paid for 2 hours. Like, it's totally unfair. I didn't look at that one because I looked at the thing just like anybody else, and I think that's totally unfair what they're paying. That's absurd.
Agreed.
I honestly did not know that. I didn't look at it that way. It seemed okay, pretty reasonable. If you show up there a couple times a week, you're gonna pay about $12. When you bring your family along, it was $57.50. And yeah, that certainly has to change.
Yeah.
And through you, Mayor, if I may,
Yeah,
the
go
Public
ahead.
Works Manager, I understand that the attendance is minimum to none for that program so far. Is that correct?
No,
Oh,
the
great.
attendance has actually been very good.
Okay,
For the first week in June, there was 62
that's good.
attendees. By the second week, there was 68. The third week so far in June has been 45, but there has been, like, some days there's up to 20. So it is being
It's
attended, yeah.
solid.
Oh, good.
Yeah.
Yeah, I was misled.
No.
Not by you, of course. I think the other thing we missed the boat on this, in marketing this program. If you recall Winterfest, we did not mail out the brochures, and that was discussed by me. Any major event that happens, and this is a major event, wasn't mailed out. We all agreed. If you go back to our meetings, we said, yeah, it's a great idea. If it's a major, that's that. Because some people don't know how to get the website. Some people don't have computers. A simple mail out is $100, $110. Everybody in town gets it. And I think that's the way it should go from now on, especially major events, because people, they know the time, they know the cost. And then they could react and see the cost, you mail how much it costs per visit.
Right, so like in our scheduling, when we do our
Programming
scheduling for the
scheduling.
summer programming
Yeah.
and then have
And
it.
when I did that, when I worked here, every summer program was always mailed out to every individual in this community. Even though they saw on a computer, they still had it in their, put on their fridge, and I think that's money well spent. But I thank you.
Okay, thank you, Counselor. So, so I think we have consensus across the board that we do want to open this up. My consideration is that if we're able to, I'm not sure, you'll have to look into this for me, Eileen, or if you know, that if we do open it, can we backdate it? So that people, if they keep their receipts, I did ask Eileen if we were able to put an interim pricing in while we look into it, and we can't do that. We're restricted by our own comprehensive user fee bylaw. But that's something that I would consider doing too, because if I don't want them to hinder, like it will be a little bit of an inconvenience this summer to be paying, upwards of $55 for one family for 2 hours of use. But if we could give a receipt and then we can look at when those fees are set to make it fair for this summer. I don't know if we're able.
Yeah, that's fair.
Eileen, you can.
Oh, I can find that out. I'm not sure.
Okay. Yeah, even if we have that in the report when we look at it on the 12th, so we'll have open public consultation on the 12th. Our July 12th council meeting. Okay. And then are we, let me go back to the report here. Go ahead.
I just also wanted to bring to council's attention in the treasurer's report, if they could just look at next steps, which just talks about the 14 days public notice process. And then also the financial considerations. And there's also a chart that the treasurer had put in here where it shows the fees, the current fees, and as per Hemson, the consulting company who did the comprehensive user fee study, they had recommended a 10% increase in the fees as well. And so there are the two charts so that council can look at that and compare as well.
Okay. So for the public notice, do we have to tell them what the changes are? Or do we say that there's going to be public consultation on those? Like I'm looking at the next steps. Like so on the 12th of July, we're gonna figure out what those are with public consultation, and then we have to give 14 days notice of that change as well?
If I can get the deputy.
Yeah, go ahead.
From my understanding, we give the public the notice ahead of the 12th, so 14 days before the 12th.
Okay,
So that the public knows that we will be having that open discussion to go over the fees and they can provide input there. So it's kind of a heads up that there will be this discussion and this forum for them to provide their input on the fees.
okay. So if we were able to amend that part of the bylaw, because we are able to amend bylaws, are we not? Would we be able to do it that evening? Go ahead.
So I was speaking to the treasurer and she said we would have to do it for the August meeting
Yeah.
because there will be substantial changes to be made and we'll have to make sure that it
All aligned.
all
Okay,
flows well. And I also, if I may
Go
wanted
ahead.
to say, the treasurer also requested that when council looks at the summer fees for monthly passes, that, and in her report she puts this, you could potentially look at the winter fees for like winter skating and winter recreation. Because there's currently only the like season pass, but before the, was it 75th anniversary?
90th.
90th? The anniversary, promotion pass, there was monthly passes as well, and the pricing system was different, so, she had mentioned in her report if council would like to kind of implement a similar pass system for summer recreation sports, it could be similar for winter, so that it's consistent.
Okay. And I'm wondering too, with our open consultation, if we could look at, for things like this where we encounter a problem with our comprehensive user bylaw, if there's something that we can put within the bylaw that allows staff to say that they've occurred this problem and that if there's a magnitude for allowance of change in that. I'm not sure if it is or not, but if we can put it in there, I would like to put it in there. So,
I'm not sure, but we can find out.
okay, just because it would be a lot easier moving forward instead of having to have the consultation, if it's, especially when it's, in this case, going to directly benefit the user, like we're holding back because of our own bylaw.
Yeah.
So. Okay, is there any other points that council would like to see when we have the 12th? Any other information they need to make a decision on this? Councillor Shenman, go ahead.
Through you, Madam Mayor Eileen, do we have a breakdown? You have the numbers, but do we have the breakdown of what activities those numbers represented? You don't need that now, but if we could have that for the next, would that be, if it's available? We don't have that? No? Okay, it's the general, for 60 people or 45. Thank you.
But can we have the time frame that was, or was that for the full day, or what the program?
For the night.
For the night? Yeah. Okay.
They do multiple activities, so they do one or the other, they're all over the place.
Okay.
Oh, okay. So any other information? No? Okay, so I leave it to the treasurers for what she would require us to know to make that decision as well. Like I'm not, like we'll have her report here, but
Yes, the treasurer will not be able to attend the July 12th. Her first meeting back will be the August 16th, but
Okay,
I can try to get the information that council needs
for the 12th?
for the 12th, yeah.
Okay. I'm assuming it must work for the treasurer because that's the next steps put in the.
Oh, that was,
report?
yeah, her
Okay,
recommendation,
okay,
yeah.
okay, great. Okay, any other questions? Okay, so so we have to put the notice and public consultation on the 12th. Okay, moving on to 7.5. And Eileen, you wanted to speak to this?
So I just wanted to let council know that there is a comment period that has been extended to August 4th, which I believe it was originally, I don't know the exact date that I was supposed to go to, but it's been extended to August 4th in case council has any comments that they'd like to submit.
Okay, thank you. Moving on to correspondence, information only. If I can get a mover and a seconder, please. Moved by Councillor Drago-Stefanik, second by Councillor Peter Kistemaker. Be it resolved that the Council of Corporation of the Township of Hornepayne does hereby acknowledge receipt of the correspondence information only package attached to the agenda of the regular meeting of council held on Wednesday, June 28th, 2023. Is there any comments or discussion items from council on the information only package? And Eileen, did you want to speak to anything?
Yes, I did. If I can just let council know for item 8.2. This report was submitted by Aqua on June 16th to, I can never get it right, but it's MECP. And I also wanted to give council an update that I had spoken to Aqua, and I believe this question had come from perhaps, it might have been from most of council, but I think it was Belinda or Councillor Belinda Kistemaker that asked about the in-house consultation quotes. And I just wanted to mention that they don't have any quotes, but it definitely won't be free. So,
Okay, thank you. Is that all of the comments?
yes.
Okay. And I didn't have any comments, so no further comments or questions on the information only. I put that to a vote to acknowledge receipt. Those in favor? And that is carried and opposed. Okay, committee board updates. If I can get a mover and a seconder, please. Moved by Councillor Ted Sheneman, second by Councillor Peter Kistemaker. Be it resolved that council does hereby acknowledge receipt of Mayor Fort meetings, May 2023, as prepared by Mayor Cheryl Fort. I do want to speak to just a couple of the meetings. So I did finish the course for the Northern Ontario Economic Development course. I thought it was well done. There was, during the discussion after, there was some pieces missing. And he did ask us as a group what they were. And it was a well-knit group because there's 12 people participating. It was all virtual. But one of the topics that he didn't discuss was women's issues for Northern Ontario, which are, and they follow the same lines as Dr. Catton's reporting, is that originally during settlement of Northern Ontario, it wasn't a high priority to welcome women. They were trying to bring men to the area for jobs and that sort of thing. So we're seeing some disparities there, and he's willing to look at that. So that might be an addition to the course, and that might help the Northern Ontario Women's Caucus that's starting. So we've had 2 meetings now. We are meeting again for the terms of reference for the Northern Women's, so it's the mayors and the councillors, but it will be a service for all municipalities of Northern Ontario. And that inaugural meeting with the terms of reference will be in September, where we actually form the Northern Ontario Women's Caucus. So I think there's 2 things there is what we're trying to do is to generate more interest and advocacy towards bringing more funding to Northern Ontario so that we can welcome more people to our part of the province and make the people that are already here, add to their health and well-being. So The other item that I wanted to discuss was, the strategic planning sessions. These were really well done, so I did these on behalf of the Hornepayne Housing Corporation because we're going to be doing some strategic planning there now that the townships has done. But it was provided free from the government and it was just really well done. 4 Thursdays in the morning, and there was webinars and questionnaires. So if you ever see that come up, or if I ever see it, I'll forward it to you. And it's helpful. It was engaging, and there was quite a few of us, I think somewhere upwards of 40 participants. And then they grouped us out into workout groups. It was all virtual, and it actually worked really well. And we got to meet people across the province. And actually, Luc Deneau was on there taking it, and he reached out to me in a chat while we were on there. I think that was the only person I actually knew from the group, but anyway, that's all I have to comment on that. And if you have any questions for me, I'll take them. Okay, there being no questions, I put that to a vote to acknowledge receipt. Those in favor, and that is carried. Okay, 9.2, if I can get a mover and a seconder, please. Moved by Councillor Panik, second by Councillor Belinda Kistemaker. Be it resolved that Council does hereby acknowledge receipt of the forestry presentation and information from the Nagogami Forest Local Citizens Committee and FLCC. Any discussion on the motion? Okay, there being none, I put that to a vote to acknowledge receipt. Those in favor, and that is carried. Okay, 9.3 is council committee updates. I am not going to give a further update, but Councillor Stanek.
Yeah, thank you, Mayor. What the Dr. Catton mentioned, I was looking at my notes. I did mention my second last report that they were looking to support PHU for the air monitoring system to monitor. She said we laughed at work. You go outside, you go, oh yeah, it's dark, it's bad, smells, because they have one Thunder Bay too, North Bay and Sudbury. It's a very expensive piece of equipment, but it encompasses miles, the way it's tested. So, and she didn't get a price, but it's very, very expensive. So they will need support, as in written support, not financial support. And we should have one. We just don't have one because they can't to make decisions. The MOH, she has to have solid data. Just can't say, "Oh yeah, air is bad," or get from a neighbor in the community. So we have no meetings for PHU until September. And we have a library board meeting was canceled last week. We'll be on this week coming up.
Okay, great.
Thank you very much.
Thank you, Councillor Stanek. Any questions for Councillor? Okay, moving on. Councillor Belinda Kistemaker.
I don't have anything tonight.
Okay, thank you, Councillor. Councillor Peter Kistemaker.
Just what we all attended yesterday going to White River, I thought it was very beneficial, especially the aqua presentation. And even though we've taken it before, it's always very important. I think that we take a refresher every once in a while. And they were Tom, was his name Tom? The guy who presented.
Tony.
Tony. He was very charismatic, and I enjoyed his presentation.
Tony Glass.
Okay. Thank you, Councillor. And I have to agree that I was interested in the aqua about the source water and the source water planning, that it was interesting to me that Goody wells are used the majority across the province, and yet we use source water.
Yep.
And that I just want to know if we have a source water protection plan, because it didn't seem that way when Pat didn't answer. So I will be looking into seeing that and finding out, because if we don't, I know we had discussions with the forestry when we were looking at the forestry management plan in 2021. We had talked about keeping a buffer around that, and we did protect it with the buffer. And then we had the discussions at council table about no motorized vehicles on that. And my understanding would all of that would be encompassed in our source water protection plan, which if we do or do not have, we're kind of like, those two things should be in that plan. So anyway, that was interesting to me. Yeah. So thank you, Councillor. Councillor Stanek.
And the other one was backwater valves. That was great.
Oh,
I
yes,
did not
that's
know
right.
about that. I truly did not know about that. And that's scary if you don't have that.
Yeah.
I did not know that issue. Thank you.
Councillor Shinman.
Just I did not receive a response back yet about our inquiry about the hospital and their timing. And remember we talked about, they said they had a lack of notification for a time. I did not get a response back yet, but I will continue. I'll send another email and ask for that. I do believe the CEO was away for a few days, so
Okay, okay,
that's it. Thank you.
thank you. Yeah, that would be good to know, because then we can improve that into our emergency management planning. About, even if we have a communication guideline, so that we can send that out when we do have an emergency, so that corporations or the people that are waiting for information know the next steps from our process, right? Just for people's information, it was a few years ago when I first got on council, our emergency management response team was like 30-some people. And it was through the consultation and the emergency management teams that said, like, you really need to bring it down, because you can't manage an emergency with that many people. You need that core control group, and then you move out from there. And it did, and it has worked. It worked through the pandemic and through the fire situation, so. Thank you, Councilor Sherman. The only, I do want to just bring one update, is that at our last meeting, council did give support for the Hornepayne Housing to apply to the action or the accelerator fund. So we did move forward with that. We had a meeting on Monday night, and we will be hopefully bringing the bare minimum of our action plan to council for support on the 12th, the July 12th meeting. And just to give you a heads up, we're focusing on possibly a tiny home community area within our municipality.
That's great.
And we're looking at possible lands, so we'll have the lands and the property listed in our action plan. And I'm thinking the accelerator fund's gonna open here in the next 2 weeks, so we'll be ready to go for right after the 12th. Okay. Okay, so moving on to item 10.1. Okay, if I get a mover and a seconder, please. Moved by Councillor Ted Sheneman, second by Councillor Melinda Kistemaker. Whereas the municipal auditor, BDO Canada LPP, has identified a surplus of $74,509 in the 2022 municipal operating budget and a surplus of $12,145 in the library budget. And whereas council deems it expedient and responsible to place this surplus into reserves for future use. Therefore, be it resolved that the Council of Corporation of the Township of Hornepayne does hereby authorize the client service manager treasurer to transfer the surplus into the following reserve funds, and we have choices to be made, and the $12,145 into the library reserve. So I open the floor for discussion to council. One thing I would like to note is back when we were talking about the airport consultation that we had to do, we were under, it was NAVCAN that we needed to do. And we spent just around 22,000 of the airport dollars, and that was all of the reserve, and then we had to use reserve money from another, and we did say we would replace that with the surplus. So my suggestion is we defer, and we can find out those amounts, so we put them in, and then the only other discussion we'd have to have is where the rest of the surplus would go. Okay, go ahead.
It was the treasurer's recommendation to put the $74,509 into the levy stabilization reserve, and to put the $12,145 into the library reserve, which is stated on the recommended motion, the draft motion.
And I would totally agree with that, to use the rest of whatever's left. I think it was around 23,000 that we wanted to put back into the airport reserve. Okay. So anyway, I put that on the floor, deferred, and we'll pass it on the 12th. Those in favor? And that is carried, none opposed. Just before we move on from that, so the council is in agreement that whatever's left will go into levy stabilization, and we can have the motion brought in complete form?
Yeah, I agree.
Okay.
I agree.
So we'll replenish those two reserves we took from, and the rest to levy. Okay, item number 10.2. If I need a mover and a seconder, please. Moved by Councillor Peter Kistemaker, second by Councillor Ted Sheneman. Whereas the corporation of the township owns and operates the Hornepayne Cemetery located at 8 Becker Road in Hornepayne, Ontario, operated under cemetery operator license number CM-00056. And whereas the Funeral, Burial, and Cremation Services Act 2002 requires the municipality to maintain a care and maintenance trust fund. However, only the interest earned from these investments can be used by the municipality. And whereas Ontario Regulation 3011, Section 93 provides guidance on the following allowable allowances. 1, income earned from the investment and reinvestment of money paid into the fund or account under Section 5310 of the Act in respect of markers installed in the cemetery shall be used only to stabilize, maintain, secure, and preserve markers in the cemetery. And 2, if the work described in subparagraph 1 has been completed to stabilize, maintain, secure, and preserve markers in other cemeteries operated by the same operator. 2, income from the investment and reinvestment of money paid into the fund or account for the cemetery other than money paid into the fund under subsection 5310 of the Act in respect of markers shall be used only, 1, to maintain, secure, and preserve the cemetery, including its grounds, buildings, structures, markers, and the equipment used to maintain, secure, and preserve the cemetery. 2, if the work described in subparagraph 1 has been completed, to maintain, secure, and preserve other cemeteries operated by the same operator, including their grounds, buildings, structures, and markers, and the equipment used to maintain, secure, and preserve the other cemeteries. And 3, to pay the expenses incurred in establishing and maintaining any of the cemetery's care and maintenance funds or accounts, or to purchase equipment to be used strictly for the care and maintenance of the cemetery. If A, the operator is no longer selling internment rights and is no longer selling scattering rights for the cemetery, and B, the cemetery does not generate any revenue from the operation of the funeral establishment, crematorium, or transfer service, or from the sale of caskets or markers. Ontario Regulation 3011, Section 93(1). And whereas the Township of Hornepayne generates minimal income from the Care and Maintenance Trust Fund, which results in the township funding the care, maintenance, and operating and capital improvements of the Hornepayne Cemetery from the taxation levy. Whereas the Council of the Corporation of the Township of Hornepayne deems it necessary to advocate for change to the legislation to allow expenditures from the Care and Maintenance Trust Fund contributions. Therefore, be it resolved, the Council of the Corporation of the Township of Hornepayne hereby requests that the Ministry of Public and Business Service Delivery, MPBSD, and the Bereavement Authority of Ontario, BAO, make applicable legislative changes to the Funeral, Burial, and Cremation Services Act 2002 and Ontario regulations made under the Act that would allow for municipalities to utilize funds from the Care and Maintenance Trust Fund towards care, maintenance, and operating and capital improvements of municipally owned and operated cemeteries. Be it further resolved that this resolution be forwarded to the Honourable Doug Ford, Premier of Ontario, the Honourable Khalil Rashid, Minister of Public and Business Service Delivery, the Bereavement Authority of Ontario, Michael Mantha, MPP Algoma Manitoulin, the Association of Municipalities of Ontario, AMO, Rural Ontario Municipal Association, Roma, and the Federation of Northern Ontario Municipalities, FONOM. Any discussion on the motion? So some history here. I voiced my delight actually that this was something that was back at the cemetery board when I was a councillor, and we had talked about this, and it has been sitting waiting to come to council. And I just want to applaud staff for holding it there until we brought it to council. So, and it's about trying to change up how we use the care and maintenance fund. So, and we did have quite a discussion, council may remember, when we bought the riding lawnmower, about that we couldn't take the money from the care and maintenance. There was restrictions on that. Now that was pre-COVID. We're talking about 2019 or 2020 back then. So, any further discussion on the motion? Okay, I put that to a vote. Those in favor? And that is carried, none opposed. Okay, we're having a discussion, 10.3 road maintenance service fees. Just before we start this discussion, do we have a time scheduled for our closed session? No. No? Okay. Okay, we're open the floor for discussion, and I hand it over to Councillor Peter Kistemaker.
If It's just, been brought to my attention a few times in the past, and I think everybody's aware of it. The people that owned cottages on First Government pay full tax rate. And people that are utilize the Second Government Lake as well as Cree Lake, there's no taxes being paid in the municipal system, and we're always looking for revenue generators. And I think that we should seriously look at fees for servicing road maintenance on once you get past First Government, past the last taxpayer, and as well as Cree Lake. I'm sure that I can't see much backlash because we've never asked anybody for it. It's just been an ongoing thing. Precedence was set, and you know, when the times are different, and you know, increasing fees of everything, we're having a hard time paying for just about everything that we're doing right now. And this is something that we should seriously look, and for the fairness of all. If you want to look at it, one way I look at it is if I were to get the grader or the snowplow or whatever to do my driveway in my township lot that I pay $6,200 a year municipal tax, I will have to pay a fee. But because of past history, the precedent set, you can go at the cost of I don't know how many hours it would be, and literally do beautiful road maintenance in a place that there's no revenue to be captured. But 2 kilometers this side of it, you got people paying full taxes. There's a young couple that just built a new home out there, and they're going to be paying large taxes. And then they know that as that grader goes by 50 feet down the road, from there on, there's no reason to be doing it. And everybody's benefit from everybody's getting the same benefit, but without paying into the system. So I just think that's something that we should look into, bring it up now that we have all the service delivery fees and whatnot. And we have an idea through our public works manager of how much it costs. And I would like to ask Dwayne through you, if we can get some numbers on not the cost, but how long it takes to actually grade from the last driveway, basically. Because and there's a couple things to that. There's also like the winter maintenance, how long would it take and whatnot. And there's going to be different times. So I'm thinking not one fee fits all. You know, if you have a snowstorm, they may have to spend an extra couple hours, but we have to be accommodated for that. And also it was mentioned to me that the bell tower, through you, could Eileen look into, do we have a contract that we have to keep the road open up until there? Because if we don't, then that's something that we should, you know, because this is, it's now is the time, and it's not fair for the taxpayers that pay we pay a lot of tax, and I understand why we have to, but there is things that are under our control, and I think those are the things that we should address.
Thank you for your comments, Councillor. I open up the floor for discussion. This is open discussion, so. Councillor Drago-Stefanik, go ahead.
Yeah, I agree with Peter. I'd like to get some background information, the actual cost from point A to point Z, number of hours, approximate. I don't expect down to 37 seconds, but I'd like to see, as you say, if there's a revenue generation, we missed the boat. And when somebody on this side of the red line is paying taxes and the other side are not, to me, it seems unfair.
Yeah, I think we've had this discussion a few times at our table, and I do think it's time to make a move and look at it and implement. And other areas across the regions where there are cottages and that, I know in the past they've paid like their association or what have you to have it graded. So, yeah, go ahead, Councillor Peter.
That's what one of my recommendations or suggestions or an idea going forward would be give a timeline. You know, so it's something that's not going to start next month, obviously, because the people, well, I don't know if they have a cottage association or not, but so like Nugagma, one of the fellows I work with, he has a cottage out there. They pay into a cottage association, and it goes towards road fees and whatnot. And they do every once in a while. They used to at least get the grader to come up from the town, and they would pay from the time it left. You know, and the cottage association would pay for it. So like there is a considerable population out there, and I think that it would be fair to give them a fair timeline. I'm not talking next year, like I'd like to see something done this year, which is very possible, but give them the fair, you know, time to, because there's going to be people that really don't access their cottages, and there's always going to be people that aren't going to pay. So they have, but that's the association is gonna have to work on that. That's none of our concern. Our concern is we're using public equipment that is owned by the taxpayers of this community we're putting hours and extra wear and tear on this equipment and manpower, and we're not seeing anything for it. Yet, just, down the road, people are paying full taxes for the exact same service.
Right, right. Any further comments or discussions? Councillor Shannon, go ahead.
Madam Mayor, this might be a good time to introduce the topic of amalgamation. We obviously have cottagers that are benefiting, and it's a time to look in both directions, towards the mill and to second government, and see whether or not we unify it and do that. Now, I do understand that it was many years ago that was brought up or talked about. Is it time to reintroduce that thought at a future meeting? Obviously, it's a time to look at that and see whether or not there's enough. We'd have to weigh out whether or not the income generated be, and when there would be discussions with our public works manager to see whether or not that would end up being viable or not. I don't know the population or the same as we want to go towards the mill. We either need to find either revenue sharing or a cost sharing, or find a way to have taxes, one or the other. Right? So,
Well, it's definitely a discussion that we could have, and then that's something that we could actually do a delegation on with one of the ministers, one of the ministries at Roma would be the next conference that we could get in on that. But it would be definitely a discussion, because if we are opening our user fee bylaw in for 14 days notice, do we look at other fees? Like, what other fees should we look at to ensure we're capturing all the costs for the people at the cottages? Yeah, that would be one. So, so maybe for our comprehensive user fee opening, if there's, that we label that as well, just in case we want to make changes there. Go ahead.
I did just want to say, Melissa, the treasurer, won't be here for that. And I don't know, because she's off right now and will be off that week, if she'll have time to do appropriate research for that, for the July 12th meeting.
Okay.
And I wouldn't want to mislead or have, not have correct information.
Okay, I guess the question that I'm having is, if it is open, as long as we're able to move something around, if council wants to do that during the consultation, the public consultation. Because some of these fees are directly related to that comprehensive user fee bylaw, right? Peter, did you have something?
Yeah.
Sorry, Annie, I'll give you a minute.
Also, like, when we start talking about this, I would like to be here at the meeting, and the July 12th, I cannot make it, so that would be, and if the treasurer's not available, it would be, I would like to see it in August. Sorry,
August, okay.
yeah. August 16th, the next meeting.
Okay.
We can tackle it then.
Okay,
I also wanted to mention that I'm not sure if all of it can be combined, like it might be specific to one item, but that's something I'd have to look into. Or the
Okay.
public notice, do you know what I mean? If we're
okay, and then if we look at it, is that instead of bringing the entire bylaw back, when I had asked about seeing if we can make adjustments in it within our own bylaw, is if it's broken down into sections, so we're not redoing an entire bylaw. I'm not sure. I'm just trying to make it easier on staff so that we're just pulling one section out and redoing it.
and I'm not sure either, but
Okay,
and if Jen can speak to council.
go ahead.
I was also going to say it might be easier to do it in sections, in the sense that if we're doing the entire thing, it's a massive bylaw with a lot of fees. And that open discussion, or like the council deliberations, open discussion could take a very, very long time. So it might be more like time. I'm trying to think of a word. Like, it might be better for time if it is broken up, so
Okay,
that it's not like a 4-hour meeting.
okay,
Doing sessions.
Yeah, with
organized.
specific focuses,
Yeah.
yeah.
okay. I like that recommendation. Okay, so we'll stick to the one that we have. And then, because Councillor Peter Kissmaker has indicated he'd like to be here in person for that, so we'll put that on for the 18th, I believe.
16th.
16th of August.
Thank you.
So if we are opening up fees though, then we'll have to give notice again, 14 days notice ahead of that meeting. So we have the time if that needs to be, and we can discuss it on the 12th again if we want to have a small discussion. Councillor Shannon, go ahead.
Through you to the Public Works Manager, Dwayne, where I own a property in an unorganized township, we have a local service board and a roads board that we contribute to that. Do our unorganized townships, do we bring anything back from them through a local service board, do you know, or?
Just an agreement with the Hornepayne lumber, that's it. So we can back.
Yeah, the only other revenue we generate from any unorganized townships is a volunteer payment from the, and it's on a volunteer honor basis, and it's quite frankly does not work. So, Councillor Stefanik, go ahead.
Yeah, to Mayor, to also Peter, there's some valid discussions, but I also keep in mind, I won't want this process to go quickly. I think we should consult those people that are over the line. I think they should get an opportunity to hear this say as well, to consult. There's still taxpayers distributed in different possibilities, some are not. I think we should give them the input and maybe be a simple solution.
Yeah, we would, if we're going to open up that portion of the bylaw, there will be
Yeah.
public
Yeah,
consultation.
so that we have opportunity to have this say. I mean,
Yeah, that
And I'd like
would
to
be
hear
the
their-
opportunity.
Solutions.
Yeah.
Awesome. Thank you.
Okay. So I think notice, the 14 days notice of opening that section of the bylaw would suffice for that, though. I don't think there should be extra work
Yeah.
on that part. Go ahead.
One thing I'd like to bring forward, though, to think about what level of service they're gonna expect. They didn't expect the same level of service we've been giving, so maybe they want lesser service, maybe.
They would have to, that would, yes,
Mhm.
they would have to decide that. Because realistically, 2-3 inches of snow, 4 inches of snow, like a lot of people wouldn't want, like that would be a waste of, but now if it's on SME, you're gonna do it. But that would be up to them to dictate, because we now work for them for a fee.
Within our established
Yes.
timeline, so then we can
Yes.
focus on our own
Absolutely.
area first.
Yeah.
Okay, so for that discussion, is there anything else, Eileen, that you and your staff will need for that portion of what we're talking about right now for the 18th meeting? We can bring a secondary comments back to the 12th,
If needed, yeah,
okay?
I think I'm okay for now. We'll bring it back to the August 16th meeting, but that just makes the most sense because Councillor Maker and the treasurer aren't here, but I'll look into council's requests and get that information back to council.
Okay, any further comments or questions right now on that topic? No? Okay, and I just want to say too that we're looking at the end of Becker Road too, because I think there's some plowing that goes on. Or we can, yeah, I think what we'll do is we'll leave it to the expertise of the public works manager of where these things may occur outside of our jurisdiction. And any other type of services we're providing that are outside the municipality that would fit in with this discussion as well. That might not necessarily be roads maintenance if there is anything. I'm not saying there is, but let's deal with it all at once then.
Garbage.
Garbage, okay.
Mhm.
Okay. If there's nothing else, then we'll move on to. Okay, we're moving into a closed session. I'm going to move into, we'll get a mover and a seconder, moved by Councillor Drago Stefanik, second by Councillor, yeah, you want a break?
No, I was gonna
Oh.
make a point of
Oh, yeah.
information, please.
Yes,
Really
yeah.
important. Point of information, Mayor, through you to Eileen, on under number 7.4, please make certain all those people that put the green forms, letters, that their answer about the user fees, what has been done, what is going to be done. So the information should be flowing back to them, I think.
Okay, so which item, sorry?
7.4, we discussed the
7.
user fees. I think there's courtesy respect should be shown to those people that sent in green forms and
Oh,
letters.
okay, yes.
Because I think historically something that was missed, and I think they should be put in touch which actually transpired what's going to be happening.
Okay,
Thank
so
you.
you're requesting that a letter be
From
sent
the
to,
clerk, yeah.
yeah.
What actually transpired in the discussion and what's gonna be happening, so there'll be consultation, so they know what's going on.
okay,
We did respond to the requests. We make it a habit to try to respond to
Okay.
all the residents that do put in requests.
Long as, Mary, through you, long as it was done, that's fine. If they're happy, that's fine. Long as people were, there was communicated what's happening, I'm fine with that.
okay.
Thank you.
We're gonna continue.
No, that's good. As long as, yeah, council is good with that.
Okay, but we haven't made any communication from this point because we just decided it.
Yeah,
So there'll
and
be,
it's still in discussion, right? So,
but we know what our next steps are, right? We're going to put it up for the public notice, and then was there multiple, like, can we email?
well, but the public will be notified of that, right? So then they'll have the opportunity to then join the public consultation.
Exactly. I think, but what we're asking for is consideration of the people that took the time to put the notice in, that we follow up directly with them.
Okay.
Yeah, okay. And then I think these are some items, I've written it down a couple of times tonight. These are all items that need to go into our communication policy, so that we're not, reinventing the wheel every time we sit here. So,
Thank you.
any further questions? No, we're good. Thank you, Drago. So, like I was saying, we are gonna be moving into a closed session, so we will, move into that closed session. I just want to make an announcement now that as soon as we go into the close, we will be taking a 10-minute break, and then we'll convert back, okay, and then open the closed session. Okay, so if I can get a mover and a seconder to move into closed. Moved by Councillor Peter Kistemaker, second by Councillor Ted, did I see your hand? Oh, Dragos, okay. Councillor Dragos Stefanik. Be it resolved that the next portion of the meeting at 7:54 PM be closed to the public in order to discuss personal matters about an identifiable individual, including municipal or local board employees, a proposed or pending acquisition or disposition of land by the municipality or local board, and a position plan, procedure, criteria, or instruction to be applied to any negotiation carried on or to be carried on by or on behalf of the municipal or local board, pursuant to section 239(2)(b)(c)(k) of the Municipal Act 2001. Those in favor? And that is carried, none opposed. Okay, if I can get a mover and a seconder to return to open, moved by Councillor Peter Kissmaker, seconded by Councillor Ted Shannon. Be it resolved that the Council of the Corporation of the Township of Hornepayne does hereby return to open council at 8:51 PM. Those in favor? And that is carried, none opposed. So business arising from the closed session, just for the consumption of the public. All matters from 12.2 to 12.3 will be continuing on as we look for further updates, and I look to Councillor Belinda Kistemaker for 12.4.
Nothing will be added at this time, and it will be brought up at council later.
Okay, thank you. And moving on to adjournment, if I can have a mover and a seconder for the confirmatory, moved by Councillor Drago Stefanik, second by Councillor Ted Shannon. Be it resolved that bylaw number 2016, being a bylaw to confirm the proceedings of council at their regular meeting held on Wednesday, June 28th, 2023, be hereby read a first and second time and be considered read a third time and finally passed. Those in favor? And that is carried. And 14.2 is the adjournment. If I get a mover and a seconder, moved by Councillor Peter Kistemaker, second by Councillor Belinda Kistemaker, be it resolved that council does hereby adjourn this regular meeting of council held on Wednesday, June 28th, 2023 at 8:52 PM. Those in favor? And that's carried. Okay.
Unbelievable.
Yeah.